So, ladies and gentlemen, it's my pleasure now to introduce Adesh Sirjusingh. Adesh is a university graduate of the West Indies. He did his postgraduate training in the UK. He now holds the job of the Director of Women's Health at the Directorate of Women's Health within the Ministry of Health. He gave up his lucrative private practice and all that goes with it to become a civil servant, and he has served selflessly for the last 7 years in this very important job. His work has been recognized by PAHO and the World Health Organization. Is now a model, a developmental model for our neck of the woods. And his work has also been recognized by the ever-discerning Answer McCall Foundation, who honored him with $500,000. Is that right, Adesh? I'm going to send the bandits after him later. He said to remind you, it's TT dollars. $500,000 TT dollars and a big prize, a gold medal for his work in maternal care. It's my pleasure to welcome Adesh.
Great. So I was asked to speak a bit on an overview of maternal morbidity and mortality in Trinidad and Tobago. For the period, I actually assumed the title of director in the year 2017, so these statistics emanate 2018 and beyond. So just a quick note, Honorable Minister is on his way. They had an emergency session of the Cabinet of Trinidad and Tobago, and that's why he's a bit delayed, but he will be hopefully arriving and giving his presentation at some point during the proceedings. So for those who are of course, visitors here, this is just a quick snapshot, as quick as I could summarize it. We have 5 regional health authorities which are relatively autonomous. There are 6 maternity hospitals currently in the public healthcare system, of which almost 92, we are responsible in the public healthcare system for 92% of the annual births. This has been so for the last few years. There are currently 5 neonatal intensive care units with about 83 beds of different levels as of January 2024. These are going to be expanded during the course of the year as we escalate the services at some new hospitals, and we also have some new units about to be put into operation. The service is free at the point of service delivery. So, and this includes for our visitors. So Ingrid, in case you need to access our services, it's still open for you. It's no charge. It's free for maternity services, postnatal services, emergency care, and that is in our non-national policy. So we do have a lot of influx of persons coming from South America who are accessing our services now, which actually affects the issues we speak about, especially when it comes to morbidity and mortality, especially this group. As you would see, the same thing in UK, you have a migratory group who tend not to access care and come at the last point just to make their babies. Private healthcare sector, of course, where Paul operates out of, they are for profit. And there are 11 maternity units, and they're responsible for just around 8.5% of the annual births. And they tend to refer the high-risk cases, of course, transferred where we have a lot more services, especially intensive care unit, blood services, neonatal services in the public healthcare system. We readily accept. There's one private NICU that has formed, and they have 3 beds. They started operations last year, so they're now getting into the system. So most of our babies are actually born within an institution. We rarely do home deliveries anymore. That's in the last few years we've migrated towards hospital. We still allow deliveries led by midwives and so on, but they're done in the institution. There are a lot of issues, including safety issues and so on, that has led to that. This slide, the bottom bit has disappeared, but it's supposed to say that it's the period 2012 to current, and this is by month. This shows the annual live births for that period of time. And you can see there's been a steady decline in the 1970s, 80s, 60s, and so on. We had 30,000 plus deliveries and that started to slow down. We had around 25,000 in the 80s, and it kept going down. So, of course, there are many reasons for that, and that's probably why we're here as well. We have a lot more older persons, young women, but older for pregnancy, having babies. Yeah. And you saw this slide in a snapshot in what Sierra was trying to say about Trinidad and Tobago in that world report. Is an international report. So finally, for the very first time, Trinidad and Tobago statistics has been reliably reproduced on the international report. So when one searches for Trinidad and Tobago, no longer you get these way off estimates. This was validated by these agencies in the year 2020. To the right of this slide, that lower, the top line, that pinkish line, is the world. Statistics for the global mortality is over 200 and something. I can't really read this slide from here, but the other slide shows the Caribbean region, the Pajos region. That's where we are. We are better performing. We are in the 60s. This is a maternal mortality ratio. Our denominator is the ICD-11 denominator, which is per 100,000 live births as opposed to maternities. And Trinidad and Tobago, as you heard, was somewhere in the 20s in this estimate. This is something, a little dashboard we use in our country that we have established. These are based on, again, in reporting systems that are aligned to ICD-11, to the Pan-American region, and so on. So they may be slightly different for the UK audience. The first one is the maternal near-miss ratio, is the number of near-misses. We have a system of classification per 1,000 live births. It's an index of the resources that may be needed for this. So it's a little more ministry level. The next one is self-explanatory, is the number of near misses to maternal mortalities. That ratio for the entire period of statistics is 29:1. Is number of cases saved in a way. For last year, there was 1 maternal death, and there were 97 near misses in our database. So that's why the ratio looks at. And this brings me to statistics for small islands like ours. One death is multiplied significantly when it comes to putting the statistics. So I've tried to put it over a denominator. If you look at the column in the middle, at the bottom, it's 87,000, almost 88,000. So we have a better reflection. 1 year could make a big difference in these statistics. So for last year, because we had 1 death, it reflected as 7.8 per 100,000. Yeah. So and that's why we're here again, because the majority of our maternal deaths were due to indirect causes, just like what you're hearing. In fact, when you add, we had 7 deaths from COVID-19, as well as 3 influenza-related deaths. That's 10 out of those 22. 2 cardiac disease, 2 sickle cell complications. So you're adding the numbers up. So all of these continue to be the focus of why we are here today again. So it's very timely to have a wisdom being established. I'm really happy to be part of this. We're looking at sustainability. We've had sort of loose arrangements in the past, but they've come and gone, where we've had experts helping us. But this will be sustainable, and it's going to be very important to the future. And basically, I think that's my slides. Thank you very much.